My name is Dr. Janice Brunstrom, and I'm director of the Cerebral Palsy Center at St. Louis Children's Hospital and Washington University School of Medicine. So I have cerebral palsy. Cerebral palsy is a movement disorder where you have trouble keeping your balance, moving your arms and legs. Almost uniformly you have some trouble walking, either with balance or with walking, and usually it's just much more trouble with walking. Like I have to use a cane if I go out in public because I'll trip and fall over, and I get really stiff sometimes. And so you can feel kind of relaxed one minute, and then the next minute you're stiff as a board and you can hardly move. So forget about, there are definitely kids with CP that can run, but those are like the GMFCS ones that are they're relatively mildly affected. But for the rest of us, it gets really hard, and so you never get to the feeling of going fast. If you don't move fast and you don't know how to run, you never get to experience that. So anything that gives you that feeling of like going, it's hard to match it to anything else. We frequently will recommend bikes because it gives them another way to be active, but it also gives them a way to strengthen their legs and extend their legs more so they're not sitting in a 90-90 position all the time. And so my job is easy because I just say, I really think you need an adaptive bike. The hard thing is sometimes selling parents on it because they're like, well, what does that mean exactly? Well, it's not really a bike. It's a tricycle because it's got 3 wheels. So they don't get it, right? So no, it's a bike. Whether it's got 3 wheels or not, it doesn't really matter. But it's a bike that you can ride. So we have bikes here that we just put the kids on, and that sells it. That changes their mind. So people ask about therapeutic benefits of bikes and equipment and things like that. But I guess you could ask the question a different way. Because, I gave a talk once. I've given lots of talks, but one of my very first talks about pushing for sports and things like that. And I was trying to sell these doctors and people on sports. And finally this doctor, and on the, we look at the differences that we're seeing, and here's the data. And this doctor raises his hand and he says, that's all great and everything, Jan, but lots of kids play sports. Why do you have to convince people that it's a good idea for kids with CP to play sports by saying that it's therapeutic when lots of kids without CP do it because it's fun, because they want to have fun? So the added bonus is that it is therapeutic, but the bottom line is we want these kids to participate so they can have fun. So they shouldn't have to prove that they're worthy of getting to have something like a bike, because it's not always about did it make them stand up better, did it make them walk better, even though it does help them get stronger and it can help keep their muscles looser or keep their hamstrings stretched out, for example. But even if it didn't do any of that, if all it did was give them a chance to have fun and go off and ride bikes just like everybody else, as long as they wear a helmet and things like that, why isn't that enough? I don't see how anybody could watch faces of these kids when you have them walk around and do all this stuff, and then you put them on a bike and you see what happens. That right there tells you what the impact is. They want charts and numbers, that's a whole separate thing. And then you have to have funding for studies and things like that. We know what our numbers show and we know how our patients do, but look at the kids. I think that if an organization wants to raise money for a really good cause, they just have to look and see how happy these kids are. They should think about when their kids first got their first bikes, or maybe if they can think back far enough when they got their first bike. A lot of these patients, a lot of these kids get so few things, so few experiences that are similar to typically developing kids to be able to have a chance to feel and do what typically developing kids do. If you could have something really as simple as a bike that you can put them on, and they can have a helmet like everybody else. They better wear a helmet. And they can ride around. I've got patients on adaptive bikes that can ride faster than their friends on 2-wheel bikes, and they think it's hilarious, and it's great. It makes them feel really great about themselves.